I'm Dr. Dean Adele. Welcome to Medical Breakthroughs. Have you ever had the feeling of your heart skipping a beat? We're not talking about love here, but a much less romantic condition called atrial fibrillation, or AF. More than 2 million Americans are affected, and if left untreated, it can be dangerous. That's why doctors are looking at ways not just to treat AF, but to put hearts back in sync.
My heart would race, or it would be irregular, and I could tell I wasn't getting, enough oxygen.
It gives the patients a feeling of impending doom, or they think, well, is this what a heart attack feels like?
When it first hits, you're afraid you're going to die, and after about 6 hours of it, you're afraid you're not going to die.
Atrial fibrillation is by far the most commonly occurring cardiac arrhythmia.
When the two top chambers don't beat normally, don't push the blood through the heart normally.
Experts say as many as 10% of Americans over the age of 75 have it.
Other important risk factors are high blood pressure, heart valvular disease, such as rheumatic heart disease as an example, and coronary artery disease.
Normally, your resting heartbeat should be 60 to 90 beats per minute. Atrial fibrillation is an electrical disturbance causing the two upper chambers of the heart to quiver frantically rather than beat effectively.
If that blood clots in that part of the heart and then the blood clot goes out, the patient can have a stroke.
In fact, 15% of all strokes occur in people with atrial fibrillation.
You also can have heart failure, where the heart overall doesn't pump enough blood.
Antiarrhythmic medications and beta blockers are often prescribed as a first step to suppress the erratic beat.
Those medications are effective in about 50 or 60% of patients.
The drugs had undesirable side effects. When I backed off the drugs, then the atrial fib would start again.
When drugs don't work, improved surgical techniques have made ablation therapy a second line of defense. Maze procedures, which use a series of precise incisions to interrupt abnormal electrical impulses, were first used 20 years ago.
Going through the breastbone, going on the heart-lung machine, or we might say the whole 9 yards. Most of these patients don't want that because it's major surgery.
So surgery evolved. Today, open surgical ablation procedures like Maze may only be done when a patient must also undergo valve or bypass surgery. Now doctors may be more likely to recommend something less invasive, like the mini Maze done through 2 small incisions.
This clamp has gold-plated electrodes on them. When we close this and hit a foot pedal, we deliver energy through here.
AFib took life away from me. He gave it back to me, so.
Another revolution uses catheter ablation techniques.
Cardiac ablation procedures that falls into the category now of a curative procedure when you go up with catheters from big vessels in both groins.
Cutting-edge 3D mapping technology guides surgeons.
We can see where we are working inside the atrium, which assists us in precisely localizing the ablation lesions.
Then radiofrequency ablation uses heat to zap troubled heart tissue.
The electrical current goes through the tissue and heats it up, actually heats it up to a point where it essentially destroys it.
Another technique currently being studied, called cryoablation, uses extreme cold.
Essentially, it's nitrous oxide down a fine tube under pressure, and when that's released into the tip of the catheter, it cools it, and you can get down to minus 90 degrees centigrade, so it's extremely cold, thus destroying the tissue.
I haven't had one irregular heartbeat that I can detect since.
Doctors say these procedures work in about 80% of cases, so if you have atrial fibrillation, you have options.
Today we do have therapies that can really help them get rid of the atrial fibrillation.
Cardiac ablations do carry risks. In catheter ablations, the most common complication is bleeding from the groin. There may also be inflammation of the heart. Though extremely rare, it's worth a discussion when considering your treatment for atrial fibrillation.